Hello, and welcome to our webinar on navigating heart rhythm problems and palpitations, your guide to symptoms, diagnosis, and management. Please ask your questions using our chat function. Dr. Ahsan will try and answer as many as possible before the end of the webinar. This webinar is being recorded and you will be sent the recording tomorrow morning. I'd now like to introduce Dr. Syed Ahsan, consultant cardiologist and heart rhythm specialist. Dr. Ahsan sees and treats many different cardiology conditions and is a highly experienced operator. He routinely implants all types of cardiac pacing resynchronization and defibrillator devices, and also performs ablations for arrhythmia and coronary angiography. He sees and treats patients with blackout, chest pains, and high blood pressure. And I'm delighted to welcome him today to talk on this webinar about heart rhythm problems and palpitations. Thank you, Dr. Ahsan.
Thank you, Harriet. Thanks for the kind introduction. Good evening, everyone. Welcome, and thank you for giving up your time in the evening to join the presentation. I'm just going to bring up my slide. Right, so good evening. I'm Syed Ahsan, and as Hattie explained, I'm a cardiologist, and I also specialise in heart rhythm problems. And it's my pleasure to be here this evening to talk to you about navigating heart rhythm problems and palpitations. So over the next hour or so, I hope to just whiz through different heart rhythm conditions and go through everything, and then we'll have time to answer some of your questions at the end. So what we're going to cover today. What are palpitations and arrhythmias? In cardiology and medicine in general, we use a lot of complex terminology, and that can be quite daunting, quite confusing. So what I hope to do today is to walk you through what are symptoms, what are palpitations, and what are arrhythmias. I want to discuss common causes and warning signs so that you can be more aware of these, and how we diagnose rhythm problems. So really take you through the whole pathway from beginning to end. So hopefully you'll leave the webinar this evening feeling more confident and comfortable in understanding what is involved. I then want to talk about the importance of lifestyle changes, lifestyle options, as well as other pharmacological and non-pharmacological treatment, i.e. drugs and interventional procedures that we perform. And also, critically, when is it important to seek help for these conditions? What are the red flag signs that you want to watch out for? And as I say, at the end, we'll have time to hopefully go through some of your questions. Brilliant. So let's start by saying, well, what is a normal heart rhythm? So a normal heart rhythm is a regular heartbeat. In a normal heartbeat, a signal is sent from the top of the heart to the bottom of the heart, and we don't feel this. The idea is this continues. And what we want to see is, I'll just stop that. So the pumping action of the heart is critical. You have a steady electrical state, which can range, the heart rate can vary between 60 to 100 beats per minute. And this is a nice and normal regular rhythm. So this is a normal heartbeat. So what are palpitations? And I really want to get you to understand this, because palpitations mean different things to different people. But as cardiologists, palpitations are a symptom. So it's a feeling of your heart racing, fluttering, skipping, or pounding, or really anything where you can feel your heartbeat or are aware of your heartbeat. As you saw in the previous slide, when you have a nice, normal, regular heartbeat, we don't feel anything. It just carries on in the background and we're not aware of it. So any awareness of your heartbeat can be considered as a palpitation. Now, these can last for seconds, they can last for minutes. In some cases, they can even last for hours or days. And there's a huge range of different durations that we see. Most of the time, palpitations are harmless, but occasionally they can be a sign of a problem. And that's what we want to decipher and understand in this talk this evening. What will you feel as a patient? So other than an awareness of the heartbeat, you may feel butterflies in the chest, so a little fluttering in the chest. You may feel your heart jumping or stopping and starting. You may feel your heart racing very fast. So, for example, when you're watching a scary movie, you can feel your heart beating, or when you're very anxious or stressed, you can have that sensation of your heart pounding. And also, some people will feel a pulsation in their ears, maybe a thumping in their neck. And that's really, really important. So, all of these symptoms can represent palpitations. So, what are the common causes of palpitations? Well, if we look at this pie chart, it gives us the common causes. So, obviously, heart disease or high blood pressure is the one that we're interested in, and that's the one which may need more investigation. However, there are lots of other things which are relevant here. Sometimes, if you have an overactive thyroid, the thyroid gland is the gland which is responsible for your body's function and metabolism. If the thyroid gland is overactive, i.e., it's working too hard, that can also cause palpitations. Certain types of medications can also cause this. So the common medications we see are decongestants. So these are things which are commonly available over the counter. Many of us have used these routinely, but these contain certain elements which can cause your heart to start racing. One of the other common causes of palpitations is hormonal changes. So as women go through the menopause, that's a particularly common time for them to experience palpitations, because the hormonal balance in the body changes, and that in turn can lead to palpitations. And then there's sort of lifestyle factors, caffeine or alcohol. Both of these can commonly cause palpitations. Caffeine is a stimulant. It can stay in the body. Well, it does stay in the body for up to 6 hours. So if you have a cup of coffee, what we call the half-life, i.e. how quickly caffeine is broken down, is quite long. So you may have a cup of coffee in the afternoon and then you're lying in bed. The effects of caffeine are still there, and that caffeine acts as a stimulant and can cause your heart to race or cause extra beats. And that's a really common cause of palpitations that we see. And then stress and anxiety. So day-to-day stresses, worry, these can, as we've talked about, these can all make your heart beat faster or cause extra beats. One thing that's not in there is poor sleep. So sleep really has a huge impact on the occurrence of palpitations. And we often see people who are working long hours or who are just not sleeping. That in turn can lead to palpitations. So there are lots of different causes for palpitations. Some have an underlying medical cause, and some are just sort of day-to-day lifestyle factors. So it's important to be aware of what are potential triggers. So when should you worry if you're having palpitations? And this is an important thing, because we want to try and work out when a palpitation is potentially serious and when they're just nothing to worry about. And by understanding more about the different types of palpitations and how you can maybe get a much better idea of what's a worrying palpitation versus what's not, it will give you hopefully that confidence and reassurance. So what we want to do is, palpitations, if they're getting worse, if you're noticing them out of the blue, or they're happening more frequently, or you're becoming much more aware of them, that's a reason to think, okay, well, maybe this needs a bit more investigation. But really, what I want you to take away from today, one of the key things, is if you have any of these amber signs. So if the palpitations that you're experiencing are associated with chest pain, that can be a sort of a tightness or a discomfort in the chest, a pressure or heaviness. That's an important sign. If you feel dizzy or faint, so you have an episode of palpitations and you start feeling dizzy or faint, that's again needs further investigation. If the palpitations make you short of breath, so when you experience them, if they're making you feel like you can't get your breath, or you're feeling as if you're struggling, again, that's a key thing. And also, if you find that when you're trying to do some form of exertion, so even walking or exercise, and you're unable to do the things you were able to do previously because you start feeling palpitations and it limits you, that's again another important thing. A really key point here as well is one of the red flag symptoms for palpitations being serious. One of the things we as cardiologists will ask our patients is, look, is there a strong family history of heart problems? And what we're specifically looking for is there a family history of, say, someone who's died unexpectedly at a young age? And when I say young age, I mean someone who's under 50, out of the blue, no sort of previous heart problems, and they've passed away. And that's really an important thing, or a red flag, because some of these conditions that can lead to palpitations have a genetic origin, so they run through families. And so, particularly if there's a first degree or second degree relative with unexpected, what we call sudden cardiac death, then that should warrant further investigation. Okay, so I'm going to try and really simplify your heart rhythm for you. So if you are having palpitations, what's the best way to work out? So we'll start by going through these 4 common heart rhythm problems. Now, may have seen earlier in some of my slides the word arrhythmia, which sounds a bit of a mouthful, but arrhythmia is a simple word for an abnormal heart rhythm. So an arrhythmia is an irregular heart rhythm, or anything which is not the normal regular heartbeat. And we really classify heart rhythm problems into 4 broad categories. And these are things that I want to go through with you today. So atrial fibrillation, or AF, which many of you would have heard about, is becoming increasingly common because it tends to happen in patients who are older. So as we get older, the incidence of atrial fibrillation increases. This can feel like an irregular and fast heartbeat. So if you feel your heart is skipping around chaotically, it's all over the place, that could be atrial fibrillation. Why is it important? Well, we'll come to that shortly, but atrial fibrillation can sometimes not cause any symptoms. Patients will often be picked up incidentally when they visit their GP or they see another specialist and are identified with with atrial fibrillation. But it's important to be aware of this condition because it can cause stroke, it can cause an impact on how the heart is functioning. And it's nowadays easy to treat and to get it right. Okay, so then we have something called supraventricular tachycardia, or SVT for short. So this is a regular, fast rhythm where the heart suddenly starts racing and going very fast. We'll come to this again in a second. The third thing, which is probably the most common condition that patients present to my clinic with, is something called ectopic beats. So ectopic beats are extra or skipped beats, which can come from the top of the heart or the bottom of the heart. They're often completely harmless. In fact, most of the time they're completely harmless, completely benign. But patients will often describe a sensation of, oh, I suddenly felt my heart pounding for 1 or 2 beats, and then it felt as if it was stopping and starting again. And as a patient who's never had any awareness of their heartbeat before, that can obviously be quite disconcerting and quite worrying. But as I say, by and large, these are generally very benign. And a lot of the factors we talked about earlier, such as caffeine, alcohol, poor sleep, hormones, they can often trigger ectopic beats. This last one is ventricular arrhythmias. So this is a rare condition. It's not something that we see commonly. It's very unlikely that you will experience this. And it's basically a fast rhythm which originates from the bottom of the heart. So I don't want to dwell on that too much, but it's something that we need to be aware of. Now, what I'd like to do now is just explain to you how to feel your heartbeat or your pulse rate, because once you know how to do that, it actually gives us a lot more confidence in terms of if we have symptoms, understanding what to do. And the best and most definitive way to feel your heartbeat is if you go into your neck and you can feel the center of your neck. If you're a man, you can feel your Adam's apple and just go slightly to the side of your Adam's apple and press in a little bit with 2 fingers. You'll be able to feel a pounding there, or you'll feel your heart beating. And when you feel your heartbeat there, you'll be able to see the pattern of the heartbeat. Now you'll be able to see if it's regular or irregular. And that will be key to determine what rhythm problem, if any, you may have. So again, coming back to this, and I really do want to get you to understand that basically you can divide the heart rhythms that we see, things that cause palpitations, into 2 groups, regular or irregular. And the regular rhythm, so if you feel your pulse beating nice and regularly, that's almost certainly a normal rhythm. SVT will also feel regular, but it will feel much faster. It will feel like you've just done a sprint or you've run for something, and the heart rate will be beating very fast. Whereas atrial fibrillation and ectopic beats will feel irregular. So you'll feel maybe a stop-start, or you'll feel your heart all over the place. So understanding that simple check to check your pulse is a really useful tool to gain an idea as to what might be going on. So I just wanted to talk to you about these 4 things again, because these are the main causes for palpitations. And using this chart, it will give you an idea of, again, what you may be experiencing. So again, as we've talked about atrial fibrillation, the irregular heart rhythm, it can sometimes be irregular and fast. It can cause palpitations and breathlessness and fatigue, and it can be either come on suddenly or it can be gradual. Some types of atrial fibrillation are intermittent, i.e. you may have episodes lasting for half an hour or an hour, and then things go back to normal. But as I mentioned before, the main risk with this condition is the risk of stroke. Again, SVT, remember this is this very fast, regular rhythm where you will experience a sudden racing of the heart. You may feel lightheaded, you may feel short of breath. The key feature of an SVT is how it starts. So if it starts very suddenly, so 1 second you're not feeling anything, and then suddenly your heart starts racing away, that's likely to be an SVT. And again, how it stops. It's racing away and something clicks and you'll just feel it go back to normal. And that is really the take-home message for an SVT, what we call the onset and offset of the rhythm. If you have a normal regular rhythm, your heart rate can also go up, but typically it will tend to go up in increments, so it will go up gradually. Whereas the difference with an SVT is that it will be very sudden. And again, this is usually not dangerous and is something that can be fixed with a very, very high success rate very safely. Again, ectopic beats. Remember, these are the extra beats which can come normally from the bottom of the heart, but maybe also from the top of the heart. And you'll feel your heart rhythm is regular, so it will sound like this. Then you'll get a thump and maybe a pause, and it will feel like your heart's missed a beat or it's stopping and starting. Some people will describe it a bit like a car engine. When you turn the ignition, the car sort of judders and starts. The typical onset it's very fleeting. It lasts for a few seconds and it will typically occur at rest. So people will often be aware of these when they're sitting at their desk, when they're sitting on the sofa, or when they're trying to fall asleep. These are usually completely safe, usually benign, but occasionally they can represent an underlying heart problem. So it's worth investigating those further if they're particularly troublesome. But if they're happening once in a while, they're not making you feel unwell, and they're not something which sort of stops you day to day, they normally don't need further investigation. And the most dangerous out of all these, which again, as I say, is extremely rare, but is often seen in patients who've had a cardiac history. So if there's a history of heart attacks, or if there's a history of what we call cardiomyopathy, which is a heart muscle condition, you're more likely to develop ventricular arrhythmias. Now, these can be dangerous. They feel very fast. You'll feel dizzy. Some people will lose consciousness and can be associated with chest pain. And these can be potentially serious. But as I say, out of all the conditions we've discussed this evening, ventricular arrhythmias are the least likely. So, how do we diagnose arrhythmias or abnormal heart rhythm problems? So, if you're experiencing these, your doctor may refer you on to a specialist who may go on to perform some simple tests. And you would have heard of some of these, but I just want to talk you through these in a bit more detail so that you're more familiar with what they mean. So the bread and butter for a cardiologist is what we call an ECG, which stands for an electrocardiogram. These are stickers which are placed on your arms, your chest, and your legs, and they basically give us an idea of the electrical activity of the heart, looking at the heart from different directions. So it's always the starting place. We do an ECG, which gives us a really quick idea of what's going on or if there's anything obvious. It's a painless test. It takes about 15 minutes, and it gives us a lot of useful information. Now, a lot of people will who experience palpitations may be fine for 7 days. They don't have any symptoms, and then they'll have symptoms on day 8. So, how do we try and catch this? And the key way of identifying what the rhythm problem is to correlate the symptoms with the ECG. Now, the electrocardiogram, the ECG that we talked about, is a snapshot in time. So a much better way of trying to record the ECG when you're having symptoms is to give you a monitor. Nowadays, we often use what we call patch monitors, which is a little sticker that you wear. You carry on with your daily activities, you can exercise, you can shower, but it's recording your heart rhythm in the background all the time. And the beauty of this test is if you had an episode of your typical symptoms, we can go back and look at the specific time when you told us that you had symptoms, and we can look at your ECG traces. So this is a really useful test, and it's often one of the initial tests that we'll do to try and make a diagnosis. An implantable loop recorder or reveal device is useful in patients who have less frequent symptoms. So some patients will only have episodes every few months, or they may pass out or be blacking out every few months. So what this is a tiny device. It's about the size of 3 matchsticks, and it just goes in under the skin with a small injection in the outpatient's clinic. And this small device can stay in for up to 4 years nowadays, just recording all the time. So let's say, for example, you had a bad episode of palpitations. Even after you've had the palpitations, you can activate the recorder and it will store everything that's happened up until that point. And that communicates with us in the hospital or in the clinic wirelessly, remotely. So you don't need to keep coming in and out of clinics or hospitals to have a check, because it will also, you can make a transmission to us and say, I've had symptoms. Can you have a look at what happened on this particular time and day? And we can go back and have a look. But the real beauty of this device is it will also send us transmissions, even if you're not having symptoms. So if this detects something abnormal that it's programmed to detect, it will make a transmission to us. So these are some simple ECG monitoring tools that give us a really good idea of what's going on. Excuse me. What is really important in any patient with palpitations is to try and make sure that they have a structurally normal heart, i.e. the heart is of a normal size, normal function, there's no problems with the valves, it's working well. And so the best way to do that is to have what we call an echocardiogram, which is an ultrasound scan of the heart. This is a really simple, painless test. Again, takes about half an hour, and it just allows us to directly visualize the heart and do some checks on it so we can see what's going on. In patients who are having palpitations, if you have a normal echocardiogram, i.e. a normal ultrasound scan of your heart, and you have a normal ECG, we can be extremely confident that the chances of you having something dangerous as the cause of your heart rhythm problem or palpitations is extremely low. And finally, almost routinely now, we will do blood tests on most patients. And the blood tests are to look at things such as your thyroid function, as we talked about earlier, to make sure you're not anemic. Again, if you've got a low blood count or you're anemic, this can actually cause your heart to beat a lot faster, and that can cause palpitations. We can also check your kidney function. Again, the electrolytes such as your potassium and your magnesium, if these are deranged, that can also increase the risk of palpitations. So the rule of thumb is some really simple, straightforward, painless tests give us a lot of information and help us identify what's going on. And since I've been doing cardiology for the last 20 odd years, technology has evolved incredibly. So now not only can we have the tests that we discussed, but patients themselves, you yourselves, can use various bits of kit. So iPhones, Apple Watches, Fitbits, and all these can be also really useful in actually recording the ECGs that we talked about earlier. So this is particularly useful if you're having intermittent episodes, but it will also give you an indication. So for example, if your normal heart rate is sitting at 70 on your Apple Watch, and then one day it gives you an alert saying your heart rate's gone up to 180 or 190 and it's stayed there for 15 minutes, you've got a good idea that that's probably something that's not quite normal unless you were exercising very vigorously. But if you were happening when you've been sitting on the sofa or resting, then that's something that needs further investigation. Now, it's not as accurate as the ECGs or the heart monitors that we do in the hospital, but it's still a really useful tool to give us a good idea. So it's helpful for spotting patterns and abnormal rhythms. In some patients, it can cause unnecessary worry. I see a lot of patients who come in saying that their heart rate's dropped too low in the night or it's gone up. And when we look through their data, it's actually very normal. But nevertheless, overall, if you're having palpitations, these are a useful bit of kit or useful tools to give us an extra bit of information. Okay, so we've talked about what a normal rhythm is. We've talked about abnormal rhythms and what causes them. We've talked about how we investigate these and also how you measure your pulse and to give you an idea of what's a normal pulse and what's not. So let's talk about the treatments that are available. So again, with almost all heart rhythm problems, we always talk about lifestyle because whatever the condition, lifestyle makes a big difference. We've talked about caffeine, alcohol, energy drinks. These all act as stimulants to the heart and can increase the incidence of palpitations. So by reducing the amount of intake of these different things, it all will always have a positive, or most of the time will have a positive effect on reducing the incidence of palpitations. Stress, sleep, other things that we've talked about before. And so addressing these, trying to have a good sleep routine, trying to get good amounts of sleep along with exercise is also important. Now, we don't want you to exercise excessively because, again, when you're having palpitations, if you're exercising and running ultra marathons or triathlons or Ironman competitions, as some of our patients do, then that can actually make things worse. But a healthy amount of regular exercise is really important. We use various medications to treat heart rhythm problems. We've used various medications which we've used for a long, long time, and we know these medications are safe. And we use different types of drugs. So broadly speaking, when we use medications, there are two types. There are tablets that we call rate control tablets. So these are tablets which slow the heart rate down. Or if you're having ectopics or an irregular heartbeat, these will control that a bit more. And then there are more complicated drugs that we call rhythm control tablets. So these medications are designed to try and stop the palpitations or the abnormal heart rhythm from occurring. So broadly speaking, there are lots of different medications that we can use and we can use safely and effectively. Remember earlier we talked about atrial fibrillation, which is that irregular heart rhythm. And in atrial fibrillation, one of the main risks is the formation of blood clots. As the heart beats irregularly, the blood can collect and pool at the top of the heart, and those blood clots can go off and cause strokes. So one of the treatments we use, depending on various risk factors, we see every patient and we work out what is your risk of having a stroke. and then we use tablets. Now, a lot of you will be familiar with warfarin, which is a drug which was used for many, many years. But nowadays, the blood thinners have evolved, and we use tablets which are a lot more straightforward. They don't need regular blood tests, and they are very effective in preventing the formation of clots, which can cause strokes. Oh, excuse me. Okay, so I'd like to just go through a couple of patient cases of patients of mine, actually, and just talk you through their history. Now, I've tried to minimize any sort of jargon or too much medical terminology, just to make it more relevant and relatable. So Maggie was a lady I treated fairly recently. She was 62 years old. She was generally extremely fit and healthy, and her symptoms were that she presented to me with fluttering in the chest at night. She described these later as sort of episodes where she would feel like she was having butterflies flying all around her chest in the night. She felt her heart rate was just all over the place, and the episodes would last for a few hours and then they would settle down. She didn't think too much about it because they didn't seem to bother her, and when she got used to them, she just thought it was stress and anxiety. She was worrying about her grandchildren and various other things, and she attributed it all to that. When you dig a bit deeper and you asked her some more questions, she did mention that she was perhaps more tired. She did experience breathlessness. She couldn't walk quite as fast or as far as she had done previously. But again, it's one of those insidious symptoms that comes on slowly, and people tend to not pay too much attention at times. So she had these symptoms for a while, and then one afternoon she suddenly developed slurred speech and weakness in her arm. She felt she couldn't lift up a cup of tea. She was sitting with a neighbour who also noticed this, and it lasted only for approximately 3 or 4 minutes, and everything settled. And she called an ambulance and she went to hospital. And when she came to hospital, we did an ECG on her. We felt her heart rate, and she was indeed in atrial fibrillation, this irregular heart rhythm, which was going quite fast. And it turns out that her symptoms were very typical of a mini stroke, so what we call a TIA, or transient ischemic attack, which is likely caused by AF. So she was subsequently started on blood thinners and heart meds. She had a lot of the tests that we went through earlier. The heart rhythm, the irregular heart rhythm, the atrial fibrillation, was treated very effectively with a day case procedure called an ablation, which is not surgery. It's when we pass wires from the leg into the heart and deliver some energy to treat the abnormal irregular heart rhythm. And she's absolutely fine. She's back to gardening and doing everything as normal. But the reason I wanted to bring this up is because Maggie was actually very lucky. Unfortunately, some patients with atrial fibrillation don't have any symptoms initially, and they have a stroke. And when they come into hospital, they're found to be in this irregular rhythm. And this is why it's so important to know your pulse, to be able to check your pulse, or have someone check your pulse. Because if your pulse is regular and beating normally and nice and regularly, we know it's not going to be AF. But if it's irregular and you're having the symptoms like Maggie was describing, then it can be AF. And it's an important thing because obviously strokes related to AF are actually much more severe than strokes from other causes. Oh, excuse me. So the key message here is learn to monitor your heart rhythm with a pulse check. And it's something that we can all learn. It's very, very straightforward. It doesn't need fancy gadgets or gizmos. And once you know how to do it, you check your pulse every so often, and you can be reassured that things are okay. The next patient I want to talk about was Kieran. Now, Kieran was a 32-year-old gentleman. He used to work in an office. He was in a bank, I think, very fit and healthy. He used to go to the gym 4 or 5 times a week. Never had any problems previously. I've done various competitive events without any difficulty. He came to see me because over the preceding few weeks, he had noticed that when he was exercising, when he started to exercise, within a couple of minutes, his heart rate would suddenly shoot up and it would go to over 200 beats per minute. Now, he said to me, well, when I exercise, it normally takes me about 10, 15, 20 minutes to get my heart rate up to 170, 180. But now, when I'm starting to exercise, within a couple of minutes, I'm just warming up and my heart rate shot up. He also had a couple of episodes when he was under stress or in work meetings. And these episodes lasted 10 to 20 minutes. They made him feel dizzy and anxious, but he said, well, they just start and they stop by themselves. I don't do anything. Just sit down and then they just suddenly everything goes back to normal and my heart rate drops back to 65 or 70 beats a minute. Now, Kieran had an Apple Watch. And when I first met him, I said, well, we should be using this to record the heart rhythm when you have one of these episodes. So later in the week, go back to the gym, do what you normally do. And if you feel one of these episodes, then you can use your watch. And actually, that was really useful because it showed heart rate of 60, 70. And then suddenly we saw this spike exactly as he was describing. And so we did an ECG monitor, an ECG, and he had an SVT. And again, this was very easy to fix. A procedure which doesn't need surgery. We just pass wires from the leg into the heart. It took about 45 minutes under sedation with local anesthetic, and it's a curative procedure. So he'll never have to worry about that again, and he's returned to his day-to-day activity. So I highlight these cases not because most people have these, but because most of the time palpitations are actually benign and don't necessarily represent something serious. But there's certain key features, the irregularity of the pulse, the heart rate, and the onset and offset of symptoms, which can give us some big clues. So in this case, if your heart just starts racing out of nowhere, for no particular reason, and often many patients that we've seen over the years have been diagnosed with anxiety when they go to see their doctor, because the symptoms of anxiety when your heart starts racing can feel similar to symptoms of an SVT. But if you know to look out for how they start, how they stop, and the heart rate, it gives you a bit more, a few more clues to help decipher whether this is a normal rhythm or something abnormal. So my key takeaways from today are palpitations are common. Most of the time they are harmless, but they're not always harmless. And it's important to understand when they might need more evaluation. Don't ignore red flags. And just as a reminder, that's if the palpitations make you feel dizzy, if they're happening more frequently, if they're associated with chest pain, shortness of breath, or reduced exercise tolerance, or if there's any family history of unexpected death or what we call cardiomyopathy or heart muscle disease. As you've seen, hopefully today, the diagnosis can often be straightforward. It's simple, it's painless, it doesn't involve lots of complicated tests. And the treatment of these heart rhythm problems is truly curative when it works, and it's very effective. But if you're concerned, if you're worried, have some simple tests, seek some medical advice, see your doctor, come see someone like me, and hopefully we'll be able to give you more reassurance, or if there is a problem, we can get it sorted out for you. So thanks again for your time, and hopefully we've got a few minutes. Yeah, we've got about 15 to 20 minutes left for questions. And if Harry, if there are any specific things that have come up already, I'm more than happy to answer them.
Yes, thank you. We've got a couple of questions. I think you were so thorough and did such a great job. We don't actually have that many.
Okay, brilliant.
But I'll share the questions we have. So the first question is, I occasionally get palpitations, but they don't last long. How long do they need to last before I need to seek help?
So that's a good question. So if your palpitations are lasting only for a few seconds and they're not troublesome and they're literally fleeting, they're typically happening when you're out of rest and they're not related to exercise, that typically represents what we call ectopic beats, which we've discussed earlier today. Most of the time, if they're not lasting long, we can be reassured that they're not going to be dangerous. The only thing to say is if they're happening quite frequently, so they're lasting for a few seconds, but they're happening throughout the day, maybe waking you up at night, then the ectopics may need to be monitored. So we may do a 24-hour monitor or a longer monitor just to see, well, what percentage of all your heartbeats for that period of time that we're recording are these ectopics. And we'll normally allow up to 1 to 2% of your heartbeats to be these extra beats. If we're picking up 10%, 20% of the heartbeats as these ectopic beats, then that may need some treatment and further investigation. So rule of thumb is if they're happening all the time, if they're happening frequently, definitely needs further investigation. If they're happening infrequently and they're not lasting for long, almost certainly they're benign. And the first thing to do is adopt the lifestyle changes that we talked about during the talk.
Thank you so much. I can see someone's hand up. Just to let you know that we're only taking questions via the chat. If the chat function isn't working for some reason, there is a link there that you should be able to use to put anonymous or named questions. So the next question is, what symptoms do I need to look out for that mean I need immediate medical attention during a palpitation episode?
Okay, thank you for that question. So I think the key red flags that tell you need to seek medical advice urgently are if the palpitations are making you feel dizzy or faint. So if you've passed out or you feel like you're close to passing out or very dizzy, that's number one. If you're having chest pain or difficulty with your breathing, and the palpitations are causing that, then that's the second key thing. But thirdly, if you're aware of your heart racing and it's not settling down within a few minutes, and it's just there continuously and the heart rate is very high, we've talked about how to check your pulse, then that's the third indication to seek further medical input. So a few key things, if you're having associated symptoms or if the palpitations are really not settling and making you feel uncomfortable.
Thank you. If lifestyle changes and medication don't work, are there surgical options for treatment?
Absolutely. So what we've talked about is a procedure called an ablation. Now, an ablation is something that I perform routinely done, and this procedure which is usually done as a day case or an overnight stay in almost all cases. And what an ablation is a minimally invasive procedure. So it's no surgery, there's no cutting involved. And what we do is we find a vein at the top of the leg in the crease of the groin called the femoral vein. Now that vein runs like a motorway from the top of your leg all the way into the heart. So without opening your chest to access the heart, we can now get inside the heart from the leg. And we use wires called catheters, and these catheters have got electrodes or fine ECG monitoring tools at the tips of the electrodes. And we can place the wires in different parts of the heart. Nowadays, we can also use a computer system to create a three-dimensional map of your heart. And we can rotate you, or we can rotate your heart without physically moving you back and forward. So we can be very precise in identifying areas within the heart which are causing the abnormal rhythm problems. And through those same wires that we've put to monitor the ECG signals, we can deliver what we call radio frequency energy or high frequency energy to treat the problem. So it's a tiny area in the heart which can often cause this problem if it's an SVT. With atrial fibrillation or the irregular heartbeat, we can use other tools. So we can use freezing tools or balloons. But there's lots of different minimally invasive approaches to treating this. So if you need an ablation or a treatment, it doesn't mean that you're going to have surgery. It doesn't mean that you're going to be in hospital for a long time. And normally patients who have ablations are up and about later the same day, and they're doing everything as normal within a few days. So it's a very straightforward, highly successful and a very safe procedure.
Thank you. We have one more question. I've had several ECGs and a Holter monitor, but nothing was found. I still experience palpitations, skips, heavy beats, breathlessness, chest pain regularly. Should I be concerned?
So that's a very common scenario, actually. It's not an uncommon scenario. So, the challenge historically with palpitations is that they occur intermittently. So, if someone's having chest pain, then they go into hospital, they're still having chest pain. We can identify the cause of the problem while they're having chest pain. With palpitations, they can be intermittent, as you've seen and as we've discussed today. And so if heart monitoring is not been successful, sometimes we'll do a longer period of heart monitoring for up to 14 days. And if that's not successful, then in identifying the problem, then using one of the loop recorders that we talked about. And just to remind you, that's the tiny device that goes under the skin with a small injection, doesn't go anywhere near your heart, but that can stay in for up to 4 years. So if you're worrying about your symptoms and they're still happening intermittently and you want more reassurance, that's a useful test. But also the gadgets that we've talked about today. So on most smartphones now or smart watches, there are tools that can help correlate your symptoms with what your ECG is doing. And that's really the take-home message. Being able to see your ECG when you're having these palpitations and symptoms, and that's what helps us make a diagnosis.
Thank you. We do have another question. I have palpitations mainly when at rest and generally at night, but have recently been having dizzy spells when getting up from bed or if bending down when I get up. Should I be concerned?
Thank you. That's another good question. So palpitations which are occurring mainly at rest, particularly the ones that feel like they're skip beats or if the heart's stopping and starting, as you've seen earlier, is often due to the ectopics, these extra beats which come from the bottom of the heart. Now, if you can think about your heart beating regularly, and then you have an extra source firing off a signal which interrupts the normal heartbeat, and so the heart beats in a different fashion, and that can feel very strange. It can feel, people will feel like they can't take a breath, or they feel like they've been jolted. And that's almost certainly ectopics, just by virtue of the fact that they're happening mainly at rest. And the reason they happen mainly at rest is when you're at rest, the heart rate is slower. So you can imagine between each heartbeat, there's now much more time for these extra beats to come in and interrupt the normal regular beating. Whereas when you're up and about doing activities, the heart rate is elevated, it's faster, and so there's less time for these extra beats to come in and disturb the normal regular heartbeat. So that's the first thing, but it's again very easy to detect with a heart monitor to check what's happening. With regards to the dizziness that you describe, which is happening when you stand up from sitting down or where you bend over, that's almost certainly related to blood pressure. So it's what we refer to as postural hypotension. So when you stand up from sitting down, gravity takes the blood towards your legs and your feet, less blood gets to your head, and you may have this transient wheezing or dizziness feeling. It's particularly common in the nighttime because everyone's blood pressure is lower at night. So patients will often feel these symptoms at night or in the early hours of the morning. And one of the key things you want to be doing is increasing your water intake to try and stabilize your blood pressure a bit and really try and cut back on caffeine and alcohol if you're consuming those, because they have the opposite effect on your blood pressure. So they can actually lower your blood pressure over time and make these symptoms more likely.
Thank you. We have had a couple of more questions. What is the true success rate of ablations? I have heard up to 80-90%, but is this rate after a patient sometimes receives 2 or 3 procedures?
Thank you for that question. That's a really good question. So what I'd like to explain is that we do ablations for different things. So we do ablations for the different types of heart rhythms you've seen today, whether that's AF, which is an irregular heart rhythm, whether that's an SVT, whether that's ectopics. And the success rate of the ablation is very much dependent on the condition that we're treating. So, for example, something like an SVT, which is what Kieran had in the case study where the heart suddenly starts racing and there's an extra bit of wiring in the heart causing a short circuit, that carries success rates of 96 to 97%, and the majority of patients will need one procedure. In something like atrial fibrillation, it depends on the type of atrial fibrillation, and I've not gone into too much detail on that so far, but broadly speaking, there are 2 types of atrial fibrillation. There's paroxysmal atrial fibrillation, which are intermittent episodes, where most of the time you're in a normal heart rhythm, but you have intermittent episodes of the irregularity, or persistent AF, where the heart's continuously beating in the irregular rhythm. Now, what we know, patients who have the intermittent type of AF, it's an earlier part of the whole condition. And so it's less embedded in your heart. And so success rates are 80% plus. When you go to persistent AF, which is normally later on, so the AF's been there for some time and it's evolved into this continuous irregular heart rhythm, the success rates do drop. And so for that condition, we would say after one procedure, the success rate is between 60 to 70%, and that creeps up if you need more ablations. And in some cases, where the AF's been there for 10, 15 years, we may need to do 2, maybe even 3 ablations, but that's rare. So the answer to the question is ablation success rates really vary depending on the individual, depending on what we're treating, and also depending on the state of the heart and health.
Thank you. Someone has asked, I was diagnosed with SVT 15 years ago and prescribed biasporol. I believe I pronounced that correctly. My palpitations are now like AF. A 24-hour monitor didn't show anything on that day. What do I do?
So bisoprolol is what we call a beta blocker, and it's a type of tablet. It's probably the most commonly prescribed medication for heart rhythm problems because it's effective and it's safe. If you were diagnosed with SVT 15 years ago, bisoprolol may have been useful in controlling the symptoms initially and actually for a good few years, and we see that in a lot of patients. But in a lot of patients with the medications, when they initially work, they're very effective. But over time, we have what we call breakthrough symptoms, and the palpitations can break through again. And it's not uncommon for patients with SVT to start in an SVT, which is the regular fast rhythm, which then degenerates into an irregular rhythm. So now it feels irregular, chaotic. So we often see patients with SVT also having AF. So in relation to the question, the key thing here is to, again, record the ECG, have a longer monitor, or use a smartwatch or device to try and record what's going on. And then with that information, we can make a more informed decision as to what you have and what needs to be done to get it better. But the treatments we do for AF now are very different and much more successful and safer than when I first started doing AF ablations 20 years ago or so. You know, those procedures used to take 3 or 4 hours. Nowadays, they're taking us 30 to 45 minutes. So it's a complete change. But the key in this case is to get some more diagnostic information as to what's going on, and probably also have an echocardiogram and ultrasound to look at the heart in a bit more detail.
Thank you so much. I believe I'm just doing another final check that the next one is our final question. So are heart valve problems a common cause of palpitations?
For that question. Yeah, so heart valve problems, particularly what we call the mitral valve, which is the valve which sits between the top left and bottom left chambers of the heart, can commonly be associated with 2 specific heart rhythm problems. One is called atrial fibrillation, which we've seen and you've heard a lot about today, which is the irregular heart rhythm. And the reason why that occurs is because that top left chamber of the heart stretches a little bit with the heart rhythm disorder, with the valve leaking. And when the heart stretches a little bit, it makes atrial fibrillation much more likely to occur. We also see ectopics, which we've talked about. We also see something called atrial flutter, which is a type of SVT from the top of the heart where the heart's racing. And so, you know, all those things are very commonly associated. So in answer to your question, yes, there is an association, often with the mitral valve between the left top and bottom chambers of the heart.
Thank you so much. That was our final question. So I'd just like to thank you again for joining us and your wonderful presentation. I don't know if there was anything you'd finally like to share.
No, I'd just like to thank you, Harriet, and the Cromwell for organising the talk this evening. Thank you for everyone who attended, and I hope you took away something useful from there. As I say, my details are all on this last slide. There's some useful videos on my website which talks about different types of conditions and ablations as well. And there's the Cromwell Hospital website as well, where you can get hold of me or other members of the team.
Thank you so much again. I've put in the chat some details for Cromwell and also to find out about more upcoming events like this webinar. I'd just like to thank everyone again and say goodbye. Thank you, everyone.
Thank you. Good night, everyone.